Have you ever wondered why some horses develop chronic movement problems without ever looking obviously sore? So, one answer may lie in the difference between postural muscles and movement muscles, and where latent trigger points tend to hide. So, most people think a trigger point has to hurt. That's actually not true. Many trigger points are latent, meaning they don't cause spontaneous pain. The horse may never limp, never pin its ears, and never seem uncomfortable, but that muscle isn't working the way it should. Now, here's where I think it gets kind of interesting. So, latent trigger points are commonly found in postural or tonic muscles. These are the muscles that are working all day, every day. So, they'll stabilize joints, support the spine, suspend the trunk between the front legs, and help the horse maintain posture even while they're just standing still and standing around. Unlike movement muscles, they don't get a lot of time off. So imagine if you're holding a weight straight out in front of you for an hour. It's not really heavy, but it's not going to injure you immediately, but eventually your muscles begin to shake, tighten, and fatigue. And that's what many postural muscles experience all the time, because over time, small areas within those muscles can become dysfunctional because of that overuse. The blood flow decreases, the muscle loses some of its ability to relax, and a latent trigger point develops. But the problem is because these trigger points usually aren't painful, they a lot of times go unnoticed, but they can still change how the muscle functions. So the muscle can't stabilize as effectively. It doesn't coordinate as well. It doesn't produce force as efficiently. And so the horse does what the horse does best. It compensates. Now the movement, or what we call the phasic muscles, begin taking on jobs they were never designed to do. Instead of simply creating movement, they're also trying to provide stability. And that is a recipe for complete and utter overload. And those movement muscles work harder and harder. Then they can develop active trigger points, which are painful. And suddenly the owner notices something. The horse maybe won't pick up a lead. Maybe they're going crooked, they're resistant, or their stride gets shorter. Maybe their back becomes sore. The painful muscle may not be where the problem actually began. The real issue may have started weeks or even months earlier in sort of a quiet postural muscle with a latent trigger point that no one knew was there. And this is one reason why I spend so much time talking about restoring balance between the postural and the movement muscles. If we only chase the painful muscle or the painful place, we may miss the one that started the entire chain of compensation. Pain is often the last chapter of the story. Dysfunction usually starts much earlier. So the goal isn't simply to make a painful muscle feel better. The goal is to restore the system so every muscle is doing the job it was designed to do. And that's how you improve movement. That's how you build resilience. And that's how you help prevent the next problem before it ever starts.